In this March 2021 edition of Practice Up, we're going to be looking at the iron-infection connection that is so strong some researchers are suggesting iron depletion therapy as a means of getting rid of certain infections. We're also going to be looking at a newly discovered type of cell death. It's an iron-dependent type of cell death, and when it occurs, creates iron overload intracellularly that, if it's not dealt with, is associated with a number of different chronic conditions, including neurodegenerative diseases, and we're going to be looking at some evidence-based ways of dealing with this. Lastly, we're going to look at the two most common types of anemia worldwide: anemia of chronic disease and anemia of iron deficiency. They look basically the same on a lab. They look like both people need iron. Yet, if you give one of them iron, they'll get better. If you give the other one iron, they'll get worse. I'm going to show you irrefutably, you never have to question this again, a way of identifying the two that you've probably never seen before in research. This is such a good episode. All this and so much more in this edition of Practice Up. Iron deficiency anemia versus anemia of chronic disease. When looking at a lab, anemia of chronic disease is usually normochromic normocytic, meaning the red blood cells are the normal size. MCV, MCH, MCHC will probably be normal, but red blood cell hemoglobin hematocrit will be low. So, how do you differentiate? Who gets iron? I'm going to just go back. Who gets iron? That's what we need to know, because there are people that need it. We just want to make sure we give it to the right person. Red blood cell hemoglobin hematocrit will likely be low in both types of anemia, iron deficiency and chronic disease. In level 3 of blood chemistry, we discuss how dehydration testosterone can mask this. So first of all, red blood cell hemoglobin hematocrit are not great markers because there are things that can tug it and make it higher. Okay, it's the art and science of blood chemistry. Anemia will make it low. High testosterone dehydration will make it high. If you have both, then it's normal. How do you know someone is actually anemic? We need better. Transferrin and TIBC are usually elevated in iron deficiency anemia, which makes sense. Transferrin, the liver makes more, and it's looking for iron. Please give me some iron. I need to, like a taxi cab, I need to take iron to the bone marrow so I can start making more red blood cells because this person doesn't have enough. Excuse me. Transferrin and TIBC are usually normal or low in anemia of chronic disease, and that's because, think about this, where is transferrin made? In hepatocytes, the liver. When I showed you that physiology earlier, the hepatocyte knows if there's elevated iron intracellularly. It knows that there's technically enough iron. It doesn't need to send out more taxi cabs in order to try to get more iron. So when iron is elevated intracellularly, there's plenty of iron, but it's not available. It doesn't make more transferrin. So TIBC and transferrin will typically be normal in those cases. This is where it gets fun. Ferritin, which people love ferritin. They don't like it because it's an acute phase reactant and it's high, or so it's considered to be unreliable. Look at the stats on this. 1/3 of patients, it's going to be normal. Okay, 1/3 of these patients, it's going to be normal. 1/3 of iron deficiency anemia and or anemia of chronic disease patients, it's going to be normal. What do you do then? Guys, do you see the challenge here? You see how patients are suffering and how practitioners are not doing more? Red blood cell hemoglobin and hematocrit can be low because of anemia, but it could be normal because of high testosterone or dehydration. That's not going to show you anemia. Transferrin is a great marker. It's usually high when there's an iron deficiency. It's usually normal if there's no iron deficiency or if it's anemia of chronic disease. Ferritin, people say, well, that's the marker. No, it's not. In 1/3 of people that have either one of these anemias, it's normal. Okay? And if there's iron deficiency and inflammation going at the same time, what do you do?